want to get to North Carolina right now. Again, the economy is a big thing when it comes to money. Well, money is used for people to afford health care. And in North Carolina, they have a very big issue surrounding Medicaid right now. And today, the North Carolina governor, Josh Stein, made an announcement about Medicaid, particularly the reimbursement rate reductions that he initiated 2 months ago. We're hearing that he has now canceled those rate reductions as a way to help people get short-term access to care who are vulnerable patients, right? All of this while there's a major political fight taking place between Democrats and Republicans around funding for Medicaid, which right now, with their latest stopgap bill that was passed back in the summer, if you recall, well, it's more than $300 million short when it comes to Medicaid funding that gives that needed access to care for people there in North Carolina. So, okay, now we've had it queued up. Let's listen to the governor's announcement there in North Carolina that just took place about an hour or so ago.
Secretary of Health and Human Services, Dev Sangvi, Dr. Frankie Simmons, President of the North Carolina Academy of Family Physicians, Margaret Weller Stargell, who is CEO of Coastal Horizons, and Lisa Poteet, CEO of the ARC of North Carolina, and the many providers, advocates, and legislators who are here joining us today. Medicaid is a lifeline for the more than 3 million North Carolinians across the state. Medicaid serves 1 and 4 million North Carolinians. It is the difference for those people between being able to go to a doctor's office to get better and being denied critical care because it is too expensive. For months, the General Assembly has failed to fully fund Medicaid, forcing cuts to provider rates and leaving people and providers stressed and vulnerable. The legislature's continued inaction left healthcare providers with few options, so impacted families and providers took legal action. And the result of those court cases have led us to today. North Carolina is now restoring provider rates to their September 30 levels, the rates before the cuts were enacted, so that patients can continue to receive the care that they need and deserve. So what happened? What changed? I'll talk about that, but first, some necessary context. For 6 months, the General Assembly was warned by DHHS time and time again about the impending Medicaid funding shortfall, and then without more funding, the legislature would force substantial rate cuts onto healthcare providers. What was incredibly frustrating was that both chambers in the legislature agreed that more funding was necessary. They even agreed on the amount of money that was necessary. But they failed to act in August. They failed to act in September. They failed to act in October. And they failed to act in November. Instead of providing the funding that both chambers knew was necessary, they allowed unrelated budget disputes to get in the way of doing their jobs. Their failure forced these cuts, which are causing real and damaging impacts on people's health and well-being. Their failure is irresponsible and callous, and it's infuriating because all of this was absolutely unnecessary. All they had to do was their most basic and important job, pass a budget. Understand that only one state's legislature in this entire country has not enacted a budget. That's North Carolina's. Just as the General Assembly's failure to act forced not only DHHS's hands on rates, it forced patients and providers. A number of them have taken legal action to protect patients. In the first 2 cases, courts have ruled for the patients. 3 more cases have already been filed, with even more waiting in the wings. DHHS can read the writing on the wall. So the department is restoring all provider rates to where they were on September 30th before the cuts took place. That's what's changed. Here's what has not changed. Medicaid still does not have enough money to get through the rest of the budget year. And that is even clearer now that we're nearly 6 months into this fiscal year, and we can see how Medicaid spending is actually tracking. Without additional funds, Medicaid will run out of money in the spring, which would be absolutely devastating, not only to Medicaid patients, but to the entirety of our healthcare system. Secretary Sangvi will speak to some of those consequences which we cannot allow to happen. Everyone here and the 3 million North Carolina Medicaid recipients and their families are counting on the General Assembly to step up and fully fund Medicaid. Legislators have said over and over that they will fund Medicaid. It's time to stop talking about funding Medicaid. It is time to start funding Medicaid. It's not about politics. It's about saving people's lives. I urge the General Assembly, come back to Raleigh and do your job. Make Medicaid whole, pass a budget, and join us in standing up for people's health care. I'll now invite forward Secretary Sangvi.
Thank you, Governor. Good morning, everyone. It's great to stand shoulder to shoulder with many friends and colleagues around this important issue. My top priority since taking this job was to increase access and ensure that everyone can have access to quality, affordable care here in North Carolina when they need it. And without additional funding from the General Assembly, this priority in the entire Medicaid program is at risk. Our projections show, as the Governor outlined, that Medicaid will run out of money before the end of the fiscal year. And because Medicaid is such a critical part of North Carolina's system of care, it's going to impact everyone. The entire state is at risk. Without full funding, vulnerable North Carolinians, children, seniors, veterans, people with disabilities could lose access to care that they rely on. We face the prospect of further destabilizing our healthcare system with devastating financial strain on providers. I want to be clear about what's at stake if Medicaid isn't fully funded. Services could be eliminated. Providers could be left waiting for payments that may never come. Clinics and practices, especially those in rural areas where so many residents rely on Medicaid, could be forced to lay off staff and stop serving patients or simply close their doors altogether. When funds run low, providers may have no choice but to limit the number of Medicaid patients they can see, stop accepting new patients, or shut down entirely, disrupting care or decreasing access for people who need it most. For many, Medicaid is more than a program. It is a lifeline. It provides affordable health coverage to more than 1 in 4 people in our state, including those who often face serious barriers like chronic illness, mental health challenges, unstable housing, or limited access to transportation. Cutting off access to care means halting access to doctors, behavioral health services, and prescription drugs for more than 3 million people, older adults, people with disabilities, and hardworking North Carolinians. Rural communities will be hit the hardest if Medicaid funding is not restored. In several rural counties, more than half of the population is covered by Medicaid. And the consequences go beyond health care. Medicaid contributes more than $30 billion to the North Carolina economy. It helps keep rural hospitals open and strengthens the financial stability of providers across the state. North Carolina has worked hard for years to build a fiscally responsible, high-performing Medicaid program, one that is the envy of every state in the nation. And everyone agrees that more funding is needed to keep it whole. There is simply no debate on that issue. Underfunding this program can have serious consequences and put at risk many people in North Carolina. Right now, we need the General Assembly to fund Medicaid in the best interest of our state's health. Let's do what's right and ensure that Medicaid continues to support the health and well-being of everyone in North Carolina. Thank you. I'm now going to turn things over to Dr. Simmons, who can give you a better explanation of what the real impact is on providers.
Okay, you were listening there to a press conference just an hour ago from North Carolina Governor Josh Stein and other leaders there in the state talking about Medicaid. And again, the big thing that comes out of the announcement here this morning is that the governor is going to cancel those reimbursement rate reductions that he put in place 2 months ago, at the time saying that it was something that was necessary just because of the ginormous amount of money in terms of what they don't have there in the state in order to provide within this particular service. But they want to help protect, give that short-term access to care to vulnerable patients there in the state, all while they're in this major political fight Democrats and Republicans there. And Sarah, you remember it wasn't long ago that the governor was calling for a special meeting around this topic because they were not able to reach any kind of conclusion when they reached that short-term gap funding bill in the summer. Again, $319 million. I do believe that's the number for the shortfall there in North Carolina. Medicaid continues to be a situation of an issue there in the Tar Heel State, and we'll continue to keep up with what the latest developments are there. But you heard the governor calling on lawmakers to come back to the table to figure out a solution. And of course, we'll see if and when that takes place there